Hello everyone and welcome back to a Vital Nursing 101 video. Today we are going to talk about antihistamines, specifically diphenhydramine, loratadine, and cetirizine. You may know diphenhydramine by the brand name Benadryl, you may know loratadine by the brand name Claritin, and you may know cetirizine by the brand name Zyrtec. These medications are very common. Patients may take them for allergies, itching, hives, sneezing, runny nose, watery eyes, and sometimes sleep. But just because these medications are common and many are available over the counter, does not mean they are risk-free. Antihistamines can cause drowsiness, dizziness, dry mouth, confusion, urinary retention, falls, and drug interactions. Diphenhydramine especially can cause strong sedation and anticholinergic effects. And if diphenhydramine is taken in high doses, it can cause serious toxicity. So in this video, we are going to break antihistamines down step by step. We will talk about what antihistamines are used for, how they work, the difference between first-generation and second-generation antihistamines, important side effects, major warnings, nursing responsibilities, lab monitoring, patient teaching, and what findings should be reported to the provider. And throughout the video, I will include pop test questions to help you think like a nurse. Let's start with the basics. Antihistamines are medications that block histamine. Histamine is a chemical released by the body during allergic reactions. When your body reacts to something like pollen, pet dander, dust, certain foods, insect bites, or medications, histamine can be released. Histamine can cause symptoms like sneezing, itching, runny nose, watery eyes, hives, redness, and swelling. So antihistamines help by blocking histamine from attaching to histamine receptors. A simple memory tip is, antihistamines block histamine's drama. Histamine causes the allergy drama, itching, sneezing, watery eyes, and hives. Antihistamines help calm those symptoms. The three medications we are focusing on today are diphenhydramine, loratadine, and cetirizine. Diphenhydramine is a first-generation antihistamine. Loratadine and cetirizine are second-generation antihistamines. That generation difference is very important. First-generation antihistamines are more likely to cross into the brain and cause drowsiness, sedation, confusion, and anticholinergic effects. Second-generation antihistamines are usually less sedating and are often preferred for everyday allergy symptoms. Pop test question: what chemical do antihistamines block? A. Histamine B, insulin, C. Heparin, D. Potassium. The correct answer is A. Antihistamines block histamine, which helps reduce allergy symptoms. Now let's talk about histamine in simple language. Think of histamine like an alarm signal. When the immune system thinks something is a threat, histamine helps create a reaction. That reaction can be helpful when the body is trying to protect itself, but with allergies, the body overreacts to something that is not truly dangerous, like pollen or dust. Histamine causes blood vessels to become more leaky. That can lead to swelling and redness. Histamine irritates nerve endings. That can cause itching. Histamine affects the nose and eyes. That can cause sneezing, runny nose, and watery eyes. Histamine can also contribute to hives. Hives are raised, itchy welts on the skin. So when a patient takes an antihistamine, the medication blocks histamine receptors and helps reduce these symptoms. But antihistamines do not cure the allergy itself. They reduce symptoms. For example, if a patient is allergic to cats and sits in a room full of cat hair, loratadine may reduce sneezing and watery eyes, but avoiding the trigger is still important. Memory tip: block histamine, block the itch and sneeze. Pop test question: which symptoms are antihistamines commonly used to treat? A. Sneezing, itching, watery eyes, and hives. B. Low blood sugar only. C. Blood clots only. D. Kidney stones only. The correct answer is A. Antihistamines are commonly used for allergy symptoms such as sneezing, itching, watery eyes, and hives. Now let's talk about first-generation versus second-generation antihistamines. Diphenhydramine is first-generation. First-generation antihistamines cross the blood-brain barrier more easily. The blood-brain barrier is like a protective filter between the blood and the brain. Because diphenhydramine can enter the brain more easily, it is more likely to cause sedation, drowsiness, dizziness, confusion, and impaired coordination. Diphenhydramine also has anticholinergic effects, We will talk about those soon. Loratadine and cetirizine are second-generation antihistamines. Second-generation antihistamines are less likely to cross into the brain strongly, so they usually cause less sedation. This is why patients often choose loratadine or cetirizine for daytime allergies. But less sedating does not mean never sedating. Cetirizine can still cause drowsiness in some patients. Loratadine can also cause drowsiness or tiredness in some patients, though it is generally considered less sedating. A helpful memory tip is, Benadryl brings bedtime. Claritin and Zyrtec are clearer for daytime. This is not perfect for every patient, but it helps you remember that diphenhydramine tends to be more sedating. Pop test question. Which antihistamine is first generation and more likely to cause sedation? A. Diphenhydramine. B. Loratadine. C. Cetirizine. D. Normal saline. The correct answer is A. Diphenhydramine is a first-generation antihistamine and is more likely to cause sedation. Now let's talk about diphenhydramine. Diphenhydramine, also known as Benadryl, is used for allergy symptoms, itching, hives, and allergic reactions. It may also be used for motion sickness in some situations. Some patients use it as a sleep aid because it causes drowsiness, but this is not always ideal, especially for older adults. In the hospital, diphenhydramine may be ordered for itching, mild allergic reactions, or pre-medication before certain treatments. Diphenhydramine can be given by mouth, IV, IM, or topically depending on the formulation and order. In an allergic reaction, diphenhydramine can help with itching and hives. But this is very important. Diphenhydramine is not the first-line life-saving medication for anaphylaxis. Epinephrine is the priority medication for anaphylaxis. Anaphylaxis is a severe, life-threatening allergic reaction that can involve airway swelling, trouble breathing, low blood pressure, wheezing, vomiting, or widespread hives. Diphenhydramine may help skin symptoms, but it does not work fast enough or strongly enough to reverse airway swelling and shock. So never think Benadryl first for anaphylaxis. Think epinephrine first, emergency response, airway, breathing, circulation. Memory tip. Benadryl helps hives, but epi saves lives. Pop test question. A patient has anaphylaxis with throat swelling and trouble breathing. What medication is the priority? A. Epinephrine. B. Diphenhydramine. Only. C. Loratadine. Only. D. Cetirizine. Only. The correct answer is A. Epinephrine is the priority medication for anaphylaxis. Antihistamines may be used as additional therapy, but they do not replace epinephrine. Now let's talk about loratadine. Loratadine, commonly known as Claritin, is a second-generation antihistamine. It is commonly used for seasonal allergies and allergic rhinitis. Allergic rhinitis means allergy symptoms involving the nose. Symptoms may include sneezing, runny nose, itchy nose, and watery eyes. Loratadine may also be used for itching and hives. One major benefit of loratadine is that it is usually less sedating than diphenhydramine. That makes it a common daytime allergy medication. Patients may take it once daily, depending on the product and provider instructions. Loratadine is not used for anaphylaxis. It is not an emergency rescue medication. It is used more for ongoing or mild to moderate allergy symptoms. A patient may say, "Every spring my allergies act up, and I take Claritin every morning." That is a common example. Memory tip. Loratadine lasts for daily allergy relief. Pop test question. Loratadine is generally considered what type of antihistamine? A. Second generation. B. First generation only. C. Opioid. D. Antibiotic. The correct answer is A. Loratadine is a second generation antihistamine and is usually less sedating. Now let's talk about cetirizine. Cetirizine, commonly known as Zyrtec, is also a second generation antihistamine. It is used for seasonal allergies, year-round allergies, itching, and hives. Cetirizine is also often taken once daily, depending on the product and directions. Cetirizine can be very effective for allergy symptoms, but it may cause more drowsiness than loratadine in some patients. So even though cetirizine is second generation, patients should still be warned that drowsiness is possible. A patient may say, "Zyrtec works better for me, but it makes me a little sleepy." That can happen. Cetirizine is not a rescue medication for anaphylaxis either. Again, epinephrine is the priority for anaphylaxis. Memory tip: Zyrtec can zap allergies but may make some people zoned out. Zoned out means sleepy or tired. Pop test question: which second-generation antihistamine can still cause drowsiness in some patients? A. Cetirizine. B. Insulin. C. Warfarin. D. Furosemide. The correct answer is A. Cetirizine is second generation, but it can still cause drowsiness. Now let's compare these three medications. Diphenhydramine is first generation. It works for allergies and itching, but it is more sedating and has more anticholinergic effects. Loratadine is second generation. It is usually less sedating and is commonly used for daytime allergies. Cetirizine is second generation. It is also used for allergies and hives, and it may cause some drowsiness in certain patients. Diphenhydramine may work faster for acute itching or hives in some cases, but it also has more safety concerns. Loratadine and cetirizine are often preferred for routine allergy management because they are usually better tolerated. For nursing school, remember this simple comparison. Diphenhydramine: more drowsy, more dry. Loratadine: less drowsy, daily allergy relief. Cetirizine: effective allergy relief, but can still cause sleepiness. Pop test question: which statement is correct? A. Diphenhydramine usually causes more sedation than loratadine. B. Loratadine is an opioid. C. Cetirizine is used to treat bacterial infections. D. Diphenhydramine has no side effects. The correct answer is A. Diphenhydramine is a first-generation antihistamine and usually causes more sedation than loratadine. Now let's talk about side effects of diphenhydramine. Diphenhydramine commonly causes drowsiness, dizziness, dry mouth, dry nose, dry throat, blurred vision, constipation, urinary retention, and confusion. These are anticholinergic effects. A helpful phrase for anticholinergic effects is dry, blurry, blocked, and confused. Dry mouth, blurry vision, blocked urine or constipation, confused, especially in older adults. Diphenhydramine can also cause paradoxical excitement, especially in children. Paradoxical means the opposite of what you expect. Instead of making the child sleepy, it may make the child excited, restless, or hyperactive. In older adults, diphenhydramine can be especially risky. It can increase confusion, delirium, falls, constipation, urinary retention, and cognitive impairment. It can also worsen glaucoma or urinary retention in some patients. This is why nurses should be cautious with diphenhydramine in older adults. Memory tip: Benadryl can make patients sleepy, dry, and unsteady. Pop test question: which side effect is associated with diphenhydramine? A. Dry mouth and drowsiness. B. Increased bone growth. C. Low cholesterol. D. Faster wound healing. The correct answer is A. Diphenhydramine commonly causes drowsiness and anticholinergic effects like dry mouth. Now let's talk about diphenhydramine toxicity. Diphenhydramine can be dangerous if taken in high doses. Taking more than recommended can cause serious heart problems, seizures, coma, or death. Signs of diphenhydramine overdose or toxicity may include extreme sleepiness, confusion, agitation, hallucinations, flushed skin, dry mouth, dilated pupils, blurred vision, urinary retention, fast heart rate, abnormal heart rhythm, fever, seizures, coma, or loss of consciousness. This is especially important because diphenhydramine is available over the counter. Patients may not realize that taking extra tablets is dangerous. Some sleep aids also contain diphenhydramine. Some cold and flu products may contain it too, so patients can accidentally double dose. For example, a patient takes Benadryl for allergies, then takes a nighttime cold medicine that also contains diphenhydramine, then takes a sleep aid with diphenhydramine. That is unsafe. Always teach patients to read labels. Pop test question: a patient took several extra diphenhydramine tablets and now has hallucinations, fast heart rate, and seizures. What should the nurse suspect? A. Diphenhydramine toxicity. B. Normal expected allergy relief. C. Low vitamin C. D. Improved sleep. The correct answer is A. high doses of diphenhydramine can cause serious toxicity, including heart problems, seizures, coma, or death. Now let's talk about side effects of loratadine. Loratadine is generally less sedating than diphenhydramine, but it can still cause side effects. Common side effects may include headache, tiredness, dry mouth, and sometimes drowsiness. Most patients tolerate loratadine well, but allergic reactions can still happen with any medication. Report rash, hives, itching, swelling of the face, lips, tongue or throat, difficulty breathing, or difficulty swallowing. Loratadine may need caution in patients with liver or kidney problems, depending on dosing and provider recommendations. So if a patient has severe liver disease or kidney disease, the nurse should review the order and patient history. Pop test question. Which side effect may occur with loratadine? A. Headache or tiredness. B. Guaranteed severe sedation in every patient. C. Permanent tooth growth. D. Instant blood thinning. The correct answer is A. Loratadine can cause headache, tiredness, and sometimes drowsiness. Now let's talk about side effects of cetirizine. Cetirizine can cause drowsiness, fatigue, tiredness, dry mouth, sore throat, cough, nausea, or stomach discomfort. The big teaching point is that cetirizine can still make some people sleepy. Patients should be careful with driving or operating machinery until they know how it affects them. Cetirizine may also require dose adjustments in kidney impairment. This matters because cetirizine is eliminated partly through the kidneys. Older adults or patients with kidney disease may be more sensitive to side effects. Cetirizine has also had warnings related to rare but severe itching after stopping long-term use. So if a patient reports severe itching after stopping cetirizine after long-term use, they should contact their provider. Pop test question. A patient taking cetirizine says, "I feel sleepy after taking this." What is the best response? A. That can happen. Avoid driving until you know how it affects you. B. That is impossible because cetirizine never causes drowsiness. C. Take double the dose. D. Stop all allergy medications forever. The correct answer is A. Cetirizine is second generation but can still cause drowsiness in some patients. Now let's talk about black box warnings and major warnings. Diphenhydramine, loratadine, and cetirizine do not have the same classic boxed warning that opioids do, but they have important safety warnings. For diphenhydramine, major warnings include severe drowsiness, impaired driving, additive sedation with alcohol or other CNS depressants, anticholinergic effects, and serious toxicity with high doses. CNS depressants include alcohol, opioids, benzodiazepines, sleep medications, muscle relaxants, and some anti-anxiety medications. Combining diphenhydramine with these can increase sedation, falls, confusion, and respiratory risk. Diphenhydramine should be used cautiously in older adults and in patients with glaucoma, enlarged prostate, urinary retention, asthma, COPD, or other breathing problems. For loratadine and cetirizine, major warnings include possible drowsiness, allergic reactions, and caution with kidney or liver impairment depending on the medication and patient. All antihistamines should be used carefully with alcohol or other sedating medications. Also remember, antihistamines are not a replacement for epinephrine in anaphylaxis. That is one of the most important nursing safety points in this whole video. Pop test question. Which statement is correct about antihistamines and anaphylaxis? A. Antihistamines replace epinephrine. B. Epinephrine is the priority medication for anaphylaxis. C. Loratadine is the fastest life-saving treatment for airway swelling. D. Cetirizine reverses shock immediately. The correct answer is B. Epinephrine is the priority medication for anaphylaxis. Antihistamines may help itching or hives but do not replace epinephrine. Now let's talk about nursing responsibilities before giving antihistamines. First, assess the reason for use. Is the medication being given for seasonal allergies, hives, itching, mild allergic reaction, sleep, motion sickness, pre-medication? The reason matters because you need to know what outcome to evaluate. Second, assess the severity of the allergic reaction. This is critical. If the patient has only itching and mild hives, an antihistamine may be appropriate. But if the patient has throat swelling, wheezing, trouble breathing, low blood pressure, chest tightness, or signs of shock, that could be anaphylaxis. Anaphylaxis requires emergency treatment and epinephrine. Do not treat anaphylaxis with only an antihistamine. Third, assess allergies and previous reactions. Ask if the patient has reacted badly to antihistamines before. Fourth, assess sedation level. Is the patient already drowsy, confused, weak, or at risk for falls? This is especially important before giving diphenhydramine. Fifth, assess age. Older adults are at higher risk for confusion, urinary retention, falls, and anticholinergic side effects with diphenhydramine. Children may experience paradoxical excitement. Sixth, assess medical history. Ask about glaucoma, enlarged prostate, urinary retention, asthma, COPD, liver disease, kidney disease, or seizure history. Seventh, review medications. Look for opioids, benzodiazepines, sleep medications, muscle relaxants, alcohol use, antidepressants, antipsychotics, and other anticholinergic medications. Eighth, assess vital signs and respiratory status if an allergic reaction is present. Pop test question. Before giving diphenhydramine for hives, what should the nurse assess first? A. Whether the patient has signs of anaphylaxis, such as airway swelling or difficulty breathing. B. The patient's favorite color. C. The patient's shoe size. D. The room temperature only. The correct answer is A. The nurse must determine whether the allergic reaction is mild or life-threatening. Now let's talk about lab monitoring. For most patients taking antihistamines occasionally, routine lab monitoring is not required. There is no common routine diphenhydramine level, loratadine level, or cetirizine level used in everyday nursing care. But labs may matter in certain patients. For loratadine, liver function may matter because it is processed in the liver. For cetirizine, kidney function may matter because dosing may need adjustment in renal impairment. For older adults or medically complex patients, kidney and liver function help guide safe medication use. If overdose is suspected, the provider may order labs and tests depending on symptoms. These may include electrolytes, kidney function, liver function, ECG, drug screen, acetaminophen level if combination products are involved, and other emergency labs. For diphenhydramine toxicity, cardiac monitoring may be important because high doses can affect heart rhythm. So for nursing school, the key point is this. Routine labs are not usually needed for everyday antihistamine use, but kidney function, liver function, mental status, sedation, and ECG may matter in high-risk patients or overdose. Pop test question. Do most patients taking loratadine for seasonal allergies need routine blood levels checked? A. No. B. Yes, every hour. C. Yes, before every meal. D. Yes, only after drinking coffee. The correct answer is A. Routine antihistamine blood levels are not commonly monitored in typical use. Now let's talk about administration tips. Diphenhydramine may be given orally, IV, IM, or topically depending on the product and order. If giving IV diphenhydramine, follow facility policy for dilution and rate of administration. Rapid IV administration can increase side effects like dizziness, sedation, and hypotension. Oral diphenhydramine may be taken with or without food, but food may help if stomach upset occurs. Do not combine oral and topical diphenhydramine unless directed because this can increase risk of side effects or toxicity. Loratadine is usually taken by mouth, often once daily. Cetirizine is also usually taken by mouth, often once daily. Patients should follow the product directions or provider order. Do not take extra doses because symptoms are annoying. More medication does not always mean better relief, and it can increase side effects. For liquid antihistamines, use a proper measuring device. Do not use a kitchen spoon. This is especially important for children. Pop test question. What should be used to measure liquid antihistamines? A. A proper dosing syringe or measuring cup. B. A kitchen spoon. C. A coffee mug. D. A random cap. The correct answer is A. Liquid medications should be measured with an accurate dosing device. Now let's focus on patient teaching for diphenhydramine. Teach patients that diphenhydramine can cause drowsiness. They should not drive, operate heavy machinery, or do risky activities until they know how it affects them. Teach them to avoid alcohol. Alcohol can increase sedation and impairment. Teach them not to combine it with sleep medications, opioids, benzodiazepines, muscle relaxants, or other sedating medications, unless approved by the provider. Teach them to watch for anticholinergic side effects. These include dry mouth, constipation, blurred vision, urinary retention, and confusion. Teach older adults to use caution because diphenhydramine can increase falls and confusion. Teach patients not to take more than recommended. High doses can cause serious toxicity. Teach patients to check labels. Many sleep aids, cold products, and allergy products contain diphenhydramine. Teach them not to double up. Teach them to keep diphenhydramine away from children and teens. Accidental ingestion or intentional misuse can be dangerous. Teach them that diphenhydramine may help itching and hives, but if they have trouble breathing, throat swelling, or fainting, they need emergency care. Pop test question. Which patient statement shows correct diphenhydramine teaching? A. I should avoid alcohol and driving until I know how it affects me. B. I can take extra tablets if I want stronger sleep. C. It is safe to combine with any sleep medicine. D. It is the first choice life-saving medication for anaphylaxis. The correct answer is A. Diphenhydramine can cause sedation and impairment, and alcohol can worsen these effects. Now let's focus on patient teaching for loratadine and cetirizine. Teach patients that loratadine and cetirizine are commonly used for allergy symptoms like sneezing, runny nose, itchy eyes, and hives. Teach them that these medications are generally less sedating than diphenhydramine, but drowsiness can still happen. This is especially true with cetirizine. Patients should see how the medication affects them before driving or using machinery. Teach patients not to take more than directed. Teach patients to check with the provider before using them if they have severe kidney or liver disease. Teach patients to report allergic reactions such as rash, hives, swelling, difficulty breathing, or difficulty swallowing. Teach patients that antihistamines are not enough for severe allergic reactions. If they have throat swelling, wheezing, shortness of breath, chest tightness, fainting, or low blood pressure symptoms, they need emergency care. If they have a prescribed epinephrine autoinjector, they should use it as directed for anaphylaxis and call emergency services. Teach patients with chronic allergies to reduce triggers when possible. For example, keep windows closed during high pollen days, shower after being outdoors, wash bedding, reduce dust exposure, and avoid known triggers. Pop test question. Which patient statement shows correct teaching about cetirizine? A. It may still make me sleepy, so I should be cautious with driving. B. It is impossible for it to cause drowsiness. C. It cures all allergies permanently. D. I should use it instead of epinephrine for anaphylaxis. The correct answer is A. Cetirizine can still cause drowsiness in some patients. Now let's talk about what findings should be reported to the provider. Report signs of anaphylaxis immediately. These include trouble breathing, wheezing, throat swelling, tongue swelling, facial swelling, chest tightness, low blood pressure, fainting, confusion, or severe widespread hives. Report excessive sedation. If the patient is difficult to arouse, confused, or unsafe walking, report it. Report falls or near falls. Report urinary retention, especially in older adults or patients with enlarged prostate. Report severe constipation, severe dry mouth, blurred vision, or acute confusion after diphenhydramine. Report paradoxical excitement in children if severe or unsafe. Report signs of overdose or toxicity. For diphenhydramine, report hallucinations, severe agitation, seizures, fast heart rate, abnormal heart rhythm, extreme sleepiness, coma, or loss of consciousness. Report allergic reaction to the antihistamine itself. This includes rash, hives, swelling, difficulty breathing, or difficulty swallowing. Report persistent allergy symptoms that do not improve, or symptoms that worsen. Report if the patient is taking multiple sedating medications or multiple products containing diphenhydramine. Pop test question. A patient taking diphenhydramine becomes confused, has hallucinations, a fast heart rate, and difficulty urinating. What should the nurse suspect? A. Possible diphenhydramine toxicity or severe anticholinergic effects. B. Normal expected allergy relief. C. Improved hydration. D. Low cholesterol. The correct answer is A. Diphenhydramine can cause anticholinergic toxicity, especially at high doses or in vulnerable patients. Now let's walk through a clinical scenario. You are caring for Mrs. Thompson, a 78-year-old patient admitted for pneumonia. She is restless at night, and a family member asks if she can have diphenhydramine to help her sleep. What should you think? You should think about age, confusion, fall risk, urinary retention, and respiratory status. Diphenhydramine can worsen confusion and increase fall risk in older adults. This patient already has pneumonia, so sedation could also make breathing and airway clearance worse. The nurse should not just give diphenhydramine because it is over the counter. The nurse should assess the patient, use non-medication sleep strategies if appropriate, check the provider's orders, and communicate concerns to the provider. Over-the-counter does not mean safe for every patient. Now let's do another scenario. A patient comes to the clinic with seasonal allergies. They report sneezing, watery eyes, and runny nose every spring. They need to work during the day and do not want to feel sleepy. Which medication might be more appropriate to discuss with the provider or pharmacist? A second-generation antihistamine like loratadine or cetirizine may be considered. Loratadine is generally less sedating. Cetirizine may work well, but can still cause drowsiness in some patients. The patient should test how they respond before driving or doing tasks that require alertness. Here is another scenario. A patient has hives after eating a food they are allergic to. They also develop throat tightness, wheezing, and dizziness. What should you think? This may be anaphylaxis. Do not think, just give Benadryl and wait. The priority is emergency response and epinephrine if ordered or available according to protocol. Airway, breathing, and circulation come first. Antihistamines may be given as additional treatment, but they do not replace epinephrine. Now let's compare antihistamines with other allergy medications. Antihistamines block histamine and help with itching, sneezing, runny nose, watery eyes, and hives. Corticosteroids reduce inflammation and immune activity. They may be used for more severe or persistent inflammatory symptoms, but they have their own risks like hyperglycemia and infection risk. Epinephrine is the emergency medication for anaphylaxis. Decongestants like pseudoephedrine help with nasal congestion by shrinking swollen nasal blood vessels, but they can raise blood pressure and heart rate. Nasal steroid sprays like fluticasone reduce nasal inflammation and may help chronic allergic rhinitis. So for allergies, different medication classes treat different parts of the problem. Antihistamines are great for histamine symptoms, but they are not the answer to every allergic or respiratory emergency. Now let's review the nursing school must-know points. Antihistamines block histamine. They help reduce allergy symptoms like sneezing, itching, runny nose, watery eyes, and hives. Diphenhydramine is a first-generation antihistamine. It is more sedating and has more anticholinergic effects. Loratadine and cetirizine are second-generation antihistamines. They are usually less sedating than diphenhydramine, but cetirizine can still cause drowsiness. Diphenhydramine can cause drowsiness, dizziness, dry mouth, blurred vision, constipation, urinary retention, confusion, and falls. High doses of diphenhydramine can cause serious toxicity, including heart problems, seizures, coma, or death. Loratadine may cause headache, tiredness, dry mouth, or drowsiness. Cetirizine may cause drowsiness, tiredness, and dry mouth. Antihistamines should not be combined with alcohol or other sedating medications unless the provider says it is safe. Diphenhydramine should be used cautiously in older adults because of confusion and fall risk. Antihistamines may help hives and itching, but epinephrine is the priority medication for anaphylaxis. Important nursing assessments include allergy severity, airway, breathing, vital signs, sedation level, fall risk, age, medical history, medication interactions, kidney or liver concerns, and effectiveness. Important patient teaching includes avoiding alcohol, avoiding driving until effects are known, reading labels, not taking extra doses, using accurate liquid dosing devices, keeping medication away from children, and seeking emergency care for severe allergic reaction symptoms. Memory tip: diphenhydramine is drowsy and dry. loratadine is lighter. Cetirizine can still cause sleepiness. Now let's finish with 5 true or false review questions. Question 1. True or false? Antihistamines block histamine and help reduce allergy symptoms like itching, sneezing, runny nose, watery eyes, and hives. The correct answer is true. Rationale. Histamine contributes to many allergy symptoms, and antihistamines block histamine receptors to reduce those symptoms. Question 2. True or false? Diphenhydramine is a first-generation antihistamine and is more likely to cause sedation and anticholinergic effects. The correct answer is true. Rationale. Diphenhydramine crosses into the brain more easily and can cause drowsiness, dizziness, dry mouth, blurred vision, constipation, urinary retention, confusion, and falls. Question 3. True or false? Loratadine and cetirizine are second-generation antihistamines and are usually less sedating than diphenhydramine. The correct answer is true. Rationale. Second-generation antihistamines are generally less sedating, although cetirizine and even loratadine can still cause drowsiness in some patients. Question 4. True or false? Diphenhydramine is the priority life-saving medication for anaphylaxis. The correct answer is false. Rationale. Epinephrine is the priority medication for anaphylaxis. Diphenhydramine may help itching and hives, but does not replace epinephrine for airway swelling, shock, or severe allergic reactions. Question 5. True or false? Taking higher than recommended doses of diphenhydramine can cause serious heart problems, seizures, coma, or death. The correct answer is true. Rationale. Diphenhydramine overdose can be life-threatening, so patients should take only the recommended dose and avoid combining multiple products containing diphenhydramine. And that is your beginner-friendly nursing pharmacology review of antihistamines, diphenhydramine, loratadine, and cetirizine. Remember, antihistamines block histamine's allergy symptoms. Diphenhydramine is more sedating and more drying. Loratadine is usually less sedating. Cetirizine works well, but can still make some patients sleepy. Always assess the severity of the allergic reaction first. Hives and itching are one thing, but airway swelling, wheezing, low blood pressure, or trouble breathing are emergencies. As a nurse, your job is to assess carefully, give the medication safely, watch for sedation and anticholinergic effects, teach patients clearly, and report concerning findings early. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.